Hospice and palliative care are areas of medicine that are often misunderstood, both inside and outside the medical community. It can look similar to traditional medical models, but palliative care feels very different. Hospice care and palliative medicine puts the patient and family at the center and allows space for each person's unique story to unfold. Palliative care is integrated across Providence Health Care. We have an inpatient unit at St. Paul's Hospital, outreach teams in all long-term care facilities and acute care sites, and hospice care at St. John Hospice and Mace Place.
I see people in a lot of different units: emergency, surgery, medicine, cardiac, renal, and I see them for different reasons: symptom management, discharge planning, goals of care conversations, and we're doing all kinds of different interventions for people no matter what stage they're at in their illness. And that's what I like about it, is it's really person-centered care.
What I really would love for people to know is that palliative care is not about death and dying. It's actually about living well. Now, of course, palliative care is for people who are requiring some symptom management in the context of a life-limiting illness, but it is so much more than that, and it's really about how do we live our best lives in our best condition, feeling as well as we possibly can until that time, until death comes.
Oftentimes, the reaction is they'll close their eyes, their shoulders will relax, they'll exhale deeply. It's creating a space outside of where they are in that moment. It's transporting them away from their illness. It's creating a sense of normalcy.
I've been part of our palliative outreach team in long-term care. I think what people are most surprised to learn is that palliative care is not just care for someone in their last days or weeks of life. There's a lot that a palliative approach can offer for someone with any life-limiting illness and early in the disease trajectory that can help to improve quality of life.
There are many care providers across Providence who are already integrating this work into their practice, and the palliative care team works closely with clinicians across all Providence sites.
I consult them frequently when I've got questions about pain and symptom management. They're really, really helpful when we're trying to arrive at decisions regarding goals of care, dealing with situations where we're anticipating a resident is declining and approaching end of life. I'm so grateful to them that they're here.
I couldn't thank the palliative care team enough. Right from beginning, they helped me and Mom to make aware what this team can do, what are the options for us, for Mom, how to manage her pain, spiritual, and then support, and then Mom could live a better quality of life.
As a person's illness progresses and goals change, palliative care services can seamlessly support a transition to more comfort-focused care.
People might be surprised to learn how nuanced it is in hospice care. It's not black and white, and people are living their lives, being with family and creating and enjoying a lot that happens here. It's very dynamic.
For me, and I think the family as a whole, we were a little anxious or hesitant because we didn't feel like we knew a whole lot about it. But in the end, I think what's really important to know is that it's a place where really individualized care happens. When the decision was made to go to hospice and receive palliative care, all of a sudden, it seemed a lot of weight fell off our shoulders as a family, and it was a really terrible journey, but the best part of the terrible journey was really going to hospice in the end.
Hospice and palliative care are not limited to a specific diagnosis or prognosis. Instead, they are far-reaching areas of medicine that aim to help people live as well as they can for as long as they can, however long that may be.